great success. So it's a great honor and privilege to welcome Rubina Ahmed from Director of Research and Policy Service of Blood Cancer UK. I don't need to tell this audience about what Blood Cancer UK does. This is one of the largest charity, and it's a great honor to have Rubina on stage. So Rubina leads the organizational national strategy to accelerate blood cancer research and strengthen evidence-based policy. And this is what we're actually doing here. Real-life data, which is really important. As you know, trial data is trial data. It is selected population, and I feel passionately real-world data is very, very important because sometimes we get surprises when we analyze this data. So Rubina, thanks for coming to grace this occasion, and we are looking forward to your thoughts. And we're hoping we can work with you in the future to deliver this important work on behalf of the UK. Thanks.
Thank you very much, and thank you very much for the invitation to attend. So my name's Rubina, and my email address is up there if anybody wants to contact me afterwards. And firstly, just to say this topic is quite broad. It's quite hard to describe everything that charities in the UK can do around improving NHS care, looking at current practice and treatment outcomes. So what I'm going to try to do over the next 15 minutes is just to give you a bit of a flavour of some of the work that we do at Blood Cancer UK and how you can get involved in some of that work as well. So there are a lot of blood cancer charities in the UK, and we're really lucky and privileged to have that. We can break this down into pan-cancer charities, the big ones, so the ones that work across all cancer types, and that's your Macmillans, who do a lot of work around supporting people affected by cancers, but also a strong advocacy arm, and they are kind of key allies for us in that really in that supportive care space. Cancer Research UK, I don't need to tell you, really, not one of the biggest funders just nationally, but also internationally when it comes to funding research. But they also have a really strong policy and advocacy arm. They produce a lot of the health intelligence that we use across the UK, a lot around the national statistics, and as well as producing health information. And then you have the very specific blood cancer charities. So these are smaller charities that work in a particular condition. So we have colleagues from Myeloma UK, Lymphoma Action, Leukemia UK, many others, and a lot of us come together under the umbrella of the Blood Cancer Alliance. So it's not that everybody is separate, but we also come together as a group. And then I would say that in terms of the pan-blood cancers, you have two big charities, Anthony Nolan, who are obviously focused around stem cell transplant, and then Blood Cancer UK. And I think our position is quite unique actually in the UK. So for those who don't know much about us, we are focused on saving lives and bringing forward the day where no one dies of blood cancer or their treatment. We do three things. We fund blood cancer research, and I'll talk a little bit about that. We are upping our research income expenditure year on year, and currently spend about £10 million. We'll be going up to 15 million over the next couple of years annually. We fund across all the blood cancers as well, which I think is really unique for many charities. We do a lot of policy and advocacy work, and I'll touch on some of that. And then we provide our information and support services. So I thought it would be helpful just to give you a sense of how we work across the treatment, development and access pathway. And this is a scheme that will be very familiar to many people. So you have everything from research and discovery through to clinical trials, all the way through to the sticky bit in the middle around regulatory approval, getting NICE approval, and then ultimately patient access. And in that space, Blood Cancer UK, we fund across the research pipeline, so we fund everything from basic science, and that includes small pilot grants through to big clinical trials. We, through our policy and advocacy work, do a lot of work in submissions into NICE and the Scottish Medicines Consortium. We advocate across the UK and devolved government, so we have really good links into UK government departments, so DHSE, OLS, so the Office of Life Sciences, through to through to MPs and so on. I myself sat on the development of the NHS England Cancer Plan as well, which is an interesting process, but I'm glad we got there in the end, and we actually have a plan. We, as I said, input into various plans, so the NHS Cancer Plan, but before that we had the 10-year NHS Plan, and now we're currently at the stage of looking at the Workforce Plan as well. So the plans are continual. Seek insight from our community, and this is a really important area for many charities, because we are so close to our patient communities, and we can collect their insight in a really holistic way, look at both quantitative and qualitative data, and we look at building the evidence base through not just funding research but conducting our own projects. And then when it comes to clinical and patient services, this will look different across different charities. We have a direct referral system for patients from the NHS directly into our services, and I'll talk a little bit more about that. We have our own nurse-led support services, so we have nurses manning our phone lines, producing kind of health content, and then we have something unique which I'll talk about, which is our clinical trial support service as well. And then more broadly, we do provide support for healthcare professionals as well. So just very quickly, I'm not going to talk a lot in detail about any of these areas. So if you do want to find out more, then do just come to me. But in terms of our current research funding, we have 109 research grants active at the moment, and it's coming close to almost £50 million worth of funding that is currently active in the UK, which is a huge number. Also really pleased that we focus and fund across the whole of the UK. So we have research based at 28 different host organisations across the whole of the UK, including all of the devolved nations. We fund across 11 of the 12 UK regions. I think Exeter or somewhere down in the southwest is the bit that's empty. And really importantly for us, we're growing the number of early career researchers we fund. So we launched our research strategy last year, and this is essentially what our commitments look like. So funding across all of the blood cancers, but with a particular focus on highlighting some of those least survivable and neglected blood cancers, and that includes some of the rarer blood cancers as well. That we will always involve people affected by blood cancer in our decision-making processes for awarding grants. That we really try and support innovation, technology and data science, and key for us is ensuring EDI in our research, and that comes in both aspects, both in terms of the researchers that we're funding and making sure that our processes are accessible and open to as many people as possible, but also on the other side, making sure that the research we fund actually doesn't add to health inequities and really works to drive down health disparities. We fund, as I said, across the pipeline, and I'll just show you this how it works in practice. So these are all of our schemes. As I said, we have pilot and project grants, so pilot studies, small, and I think actually we've just increased the amount to £45,000 a year for those. Project grants, which are £300,000 over 3 years. Our Transformational Research Awards are currently open, so these are large 5-year awards, and there are up to £1.5 million over 5 years, so that's been a change. Our early career advancement fellowships are also open. So these are for people who have completed a PhD, either a basic scientist or a clinician who's completed their PhD, and they're £450,000 over 3 years. This is quite a new scheme for us. We launched it 2 years ago. We've run 2 rounds, and actually the quality of applications has been outstanding. We funded 4 in the first year, and we've just funded another 4, and we haven't yet announced those awardees yet, so we're really pleased about that. And then we do a lot in partnership working as well. So moving on to what we do in terms of our support services, as I said, we produce a lot of health information. That's both printed information, that's online information as well on our website. This is a really, it's fair to say, for many organisations, it's a developing field in terms of how you produce health information and provide that in the era of Google AI, when people type in their condition and what they get is an AI overview rather than linking through to actually kind of websites and so on. So this is a really developing area for us at the moment. We will continue to provide health information in the best way possible, but we're really looking to see how we produce our content and how we make that available to more people. We provide peer support through our forum, which is a great kind of community-led area where people with, people affected by blood cancer, both patients and carers and families, really just kind of offer each other support, and we have over 5,000 people on that. And then we have emotional and practical support, which we provide through our support services, which are led by a team of nurses, and then our clinical trial support as well, which I'll come on to. So this is just a bit of some of the numbers. We've supported over 1 million people with online information. We distribute a lot of information, and then we answer a lot of emails and phone calls as well. Oh, I think I've skipped that. So this is just the impact of our work. And then I just want to talk a little bit about our referral service. And actually, the West Midlands have been one of our key partners in this as we piloted this. So we set this up a couple of years ago because what we realised was many people don't know that we exist, and that's both healthcare professionals, but that's also people affected by blood cancer as well. So through our referral service, what happens is at point of diagnosis or in a conversation with either the CNS or their consultant, people can be referred onto our services, and the consultant or the healthcare professional will ask the patient, are you happy to receive a phone call from Blood Cancer UK or an email? And people can say yes. All they provide is literally their name, what their diagnosis is, and then their email address or their telephone number and how they want to be contacted. And through that, what we can do is then really take them through a tailored 7-week email journey that sends them an email every week around the different stages of their diagnosis that they might be at, and really support them through that, and so that they know that we exist. We can phone people who request that, and that phone call comes from one of our nurses, and we prioritise people who don't have access to email. And we can also provide support in over 170 different languages using an interpreter service as well. And the aim of the information is really to help people better navigate their diagnosis with reliable health information, patient stories, and peer support. So at the moment, we're live in 25 different trusts and health boards. We've had over 815 referrals and taken people through both email and phone support services. What we find is that most people are very happy to have an email journey. And I think that's really important. So the other support that I just want to talk to you about is our clinical trial support service. We've done a lot of research around the barriers to accessing clinical trials, and as I'm sure many of you are aware, and I don't need to tell you about, it ultimately really lands down to a few key areas around lack of awareness and understanding of clinical trials, lack of reliable information, time, capacity and awareness of clinical trials from treating teams, and we hear that particularly from colleagues who might be based outside in district general hospitals or who are less involved in research, who don't have the time to engage on a day-to-day basis on all the clinical trials that might be open. And so what we know ultimately is that where you live can determine which trials are available to you. And this little pie chart just shows you, since your diagnosis, has anyone discussed with you whether there are any cancer research opportunities that you could take part in? And it's quite a low number. We would really like to see most people have a conversation about research at some point during their treatment journey. So what we do is that so people can find us either through an initial contact. Oftentimes, they might be referred by their healthcare professional who does know about that, or just normally what it is just an online search, and they come across the service that we provide. And what we do is a tailored consultation. We discuss their blood cancer diagnosis with the patient, their current medical situation, answer any questions, and try and get as much clinical information as we can plan and provide an honest assessment as to whether they are actually might be eligible for a clinical trial or not. Oftentimes, it's just a conversation to say, well, actually, if you're on active monitoring, there isn't anything for you at the moment, and having that conversation as to why a clinical trial might not be right for them. But for those patients where we think that there is a clinical trial available, what we then do is undertake an extensive trial matching service for them. So we maintain a database of all the commercial and non-commercial trials that are open in the UK. For blood cancer, we know all the sites we try and know all the sites that are open, all the eligibility criteria, and then really use that to match patients onto those trials. And then we will have a conversation with the patient to say, these are the trials that you might be eligible for, and this is how you have that conversation with your consultant to get you onto that trial. And both our journey continues is not just during the trial kind of matching process, but also afterwards as well. And since we launched that scheme a few years ago, we've had 932 referrals we've conducted 620 searches, and actually we have an 18% conversion rate. And so all of this is things that we're working on when we really want to scale up over the next year. But that's a huge number of people who otherwise would not have gone on to a trial if they hadn't come through our service. And then we also, for people who aren't eligible for a trial at that stage, we ask them whether they're happy to stay on our database, and 224 people are on that. And then if there is something that becomes available, we will match them onto that. We will then match them onto that trial as well. It's important to say we don't put people onto trials, obviously. We have to support them to have those conversations with their consultants and with the chief investigators. But what we do is really provide that wraparound care around those clinical trials. And then just quickly on our policy and advocacy work, which is probably where a lot of the work happens when it comes to actually trying to drive improvements in NHS care and outcomes. So some of the things that we've done over the past couple of years is in 2024, we launched the UK Blood Cancer Action Plan. It is a policy report, but it's very heavily evidence-based. As part of this, we commissioned 2 separate data studies, one from the Concord, who did an international benchmarking exercise, and one led by the Oxford and Welsh groups to look at data across the UK around blood cancer outcomes. And the aim of that was really to pull out some meaningful recommendations that could improve survival in adults. And so some of the headlines from that really are from the data projects that were, what we found was over 1 million potential years of life are lost to people in the UK diagnosed with blood cancer over a 10-year period. And a third of these people are under 65. So I think, traditionally we think of blood cancer and cancers being most, in terms of the number of people impacted, is obviously people over 65, but actually in terms of the impact, in terms of life years lost, a lot of that happens in that younger population. Not surprised to many people is that 5-year survival for blood cancer in the UK does lag behind similar nations, and actually, your socio-economic background has a big impact on your survival outcome. So the calculation we did was that if all persons diagnosed with blood cancer in England had the 5-year survival rates of those in the least deprived quintile, so the most advantaged people, an estimated 650 excess deaths a year could be avoided. And I'm not going to go into the recommendations in detail because they're available on our website. But there were 5 areas we looked at, and it's just important to highlight that this work is continuing, and I'll give a couple of examples of that. But it's around building a robust clinical and diagnostic workforce, improving referral and diagnosis, reducing barriers that prevent access to care, increasing access to trials, and increasing access to drugs and treatments, and then really driving improvement through our national data. One of the things that we found, and this won't be unfamiliar to many of you, is that data is patchy. England is the area where we have the most data available, but actually it's really hard to compare across nations, especially like Northern Ireland and Wales, where actually a lot of those data sets are missing. So 2 bits of work that we've done since then is we launched a piece of work into clinical nurse specialists and the workforce training and support that they need. And I'm just going to run through these because I'm running out of time. But really what we really wanted to understand was what are the barriers that CNSs across the UK are facing to better understand their training and support needs and to develop a set of training and support recommendations. The work was conducted by a group led by the University of West of England and Edinburgh Napier University, and they conducted research including really kind of desktop research, speaking to people from across the UK, CNSs, people affected by blood cancer, and our own nurses. And so really, I think, we know there are large gaps in training exist. Inconsistent induction processes. 91% of CNSs said clinical workload stops them from attending any training, and 81% said study leave is really limited or hard to secure. There's real variation in what their roles are and how their roles are described. So we've come through a set of recommendations, and the work really starts now on that piece of work. But the last piece of thing I just wanted to highlight to you is our access to treatment projects, because I think this is really key to how you go from approving drugs onto the NHS to actually making them available to people once that happens. So following NICE approval, do patients actually get access to the approved treatments that they should be getting to? How long does it take for uptake to become consistent? And is there a disparity in who gets access to what treatments? So we've just started this piece of work with IQVIA, who are a big company who hold a lot of data, and we're in the phase 1 of this, where we've selected now 10 or 12 drugs that we want them to have a look at in deep dive, and that's across many different blood cancers. It's bispecific antibodies, it's CAR-Ts, it's immunotherapies, and to really try and understand when was that drug approved and what does access really now look like to provide us the quantitative data we need. The second phase will be looking at the qualitative data, so once we've got that data, to try and understand actually why does the variation exist. So it will really come out to many of you to understand how it is working in practice across MDTs, across prescribers, across commissioners. And so that phase will come out in September, and then from that we will come on to some policy recommendations. So I'm not going to talk about this, but essentially these are the registry and data sets that they will be using. So if you want to get involved in that project, to come back to me. And then lastly, I'm just going to present this because Andy might be interested to hear this. So we did, so I'm going to come on to this. So we have a health intelligence function within our own team, and so we did an FOI out to HRA in January this year to say, well, can you tell us what blood cancer trials are open in the UK? And they kind of said, we can't. Here's all the 8,000 trials that are open in the UK between January 2020 and December 2025. And so that's every single clinical trial open in the UK. And so we ran that data through various AI models, and this is essentially what we found. That of those 8,000 trials, 1,820 were cancer clinical trials approved between January 2020 and December 2025, but actually 400 of those were blood cancer clinical trials, and then of that means that 20% of every clinical trial in the UK is a blood cancer clinical trial. However, the stats are falling. So when you look at the number that we had in 2021, there were 91 blood cancer clinical trials. That is now down to 44 in 2025. At the same time, the proportion of clinical trials that include blood cancer is also falling. So from 5.3% in 2021 to 3.2% in 2025. Going from 25.4% of cancer clinical trials to 16.4%. So not is it just decreasing in absolute numbers, it's also decreasing as a proportion as well. And then when you look at it in terms of the distribution of those trials across the UK. 377 of those 400-ish trials were developed and led through England, 4 trials in Scotland, 12 in Wales, and then 2 trials were actually led by chief investigators in Northern Ireland. However, then when you look at where cancer trials are active in the UK nations, every single trial, so all 400 patients, it will be active in England somewhere. 35% in Scotland, 22% in Wales, and only 8% of clinical trials are actually available to patients in Northern Ireland. So this is a really big issue for us. So we really need to think about not just about the number of trials that we're running, but how we increase the availability of those trials. So I'm just going to end in summary. I know I've done a whistle-stop tour and not gone through anything in any particular detail, but if people want to come to me, do come to me. But just to say, charities operate across the whole clinical pathway, from funding initial research through to supporting patients. We interact with governments, we have really good links into them, and we input and mobilise our communities. We're directly patient-facing and bring that perspective. We generate the evidence that cuts across the sector. We can hold the system to account. And I think really the other thing is to say that none of this work we can do without you guys. And we're really a partner for clinicians and the healthcare sector. So do come to us. So I will end it there. Thank you.